Good morning. I'd like to call this meeting to order, meeting of the Health and Human Services Finance and Policy Committee. It is Tuesday, April 7th, 2026. And our first bill on the agenda is Senate File 4771. Senator Hemmingsen-Jaeger. Good morning, Senator.
Good morning, Chair and members. Thank you so much. Happy to kick off the next phase of session with my bill. So thank you for your attention for hearing it. 4771 is a grant appropriated to Helping Paws. They are an accredited Minnesota nonprofit with over 38 years of experience breeding, training, and placing assistance dogs like service dogs with individuals who have physical disabilities, service dogs for veterans and first responders living with service-related PTSD, and facility dogs with professionals in courthouse, educational, and mental health settings. They have a beautiful handout, which is in your packets. I would encourage you to kind of look it over. This is really meaningful to me because if you recall, or maybe don't recall, Mark and Melissa Hoffman were really great volunteers, and that's how they ended up with Gilbert, their service dog. And I think it's an adorable story because they were training him to be a service dog. They had already trained another dog, Minnie, and apparently he was too friendly. And so he really latched on to Melissa, and it was really cool being in the house with her and hearing stories now and then. She would share stories of kind of personal stuff, and she would bring Gilbert up, and Mark Hoffman, she always talked about him in first and last name. So having served with her and experiencing the tragedy that we all felt this summer, this just feels really meaningful to me, and I think it would be a really meaningful way to kind of live out a legacy of service. So this is to sponsor a litter of puppies that will then grow up to be trained and help the next people with disabilities or that need some extra help. And it's just a really cool way for all of us to remember how we're all in this community together, and we should all be kind of looking for ways to help each other. So I don't need to say much more because my testifiers have amazing stories. So thank you for your attention again.
Thank you, and welcome to the committee. And whoever would like to go first, if you could state your name for the record and begin your testimony.
Sure. Thank you very much. Thank you, Chair Wicklund and Senator Hemmingsen-Jaeger for allowing us to be here today. My name is Elisa Golab, and I'm the Executive Director of Helping Paws. And sitting next to me, who you'll hear from shortly, is Angie Foley and Orla, a graduate team from Helping Paws. So 9 months ago, it's been another month or so to the day, Minnesota changed. I woke up on June 14th to my phone ringing off the hook, just as I imagine many of you did. It didn't make sense then, and it certainly doesn't make sense now. In the days that followed the tragic news of Gilbert being shot and killed alongside Melissa and Mark, Helping Paws, as one person shared, is a place that I could put my grief. We took this responsibility seriously. We allowed people to come and share their feelings, make phone calls. They sent cards, they made donations, and we gave multiple interviews and tours. One of those calls was from Representative Bierman. He asked what he and the caucus could do to create a lasting legacy for Gilbert. After a brief discussion, an idea struck me. We were approaching the breeding of the G litter. I said, what if you sponsor a puppy from the upcoming G litter? We name our litters in alphabet so we can keep track of them. I decided that we would name this particular litter after Gilbert. Chair Bierman said, how about we sponsor the entire litter? Let's ensure that anyone who wants a service dog from Helping Paws can get one. I was stunned, still stunned a week later when he came for a visit. I hold a tremendous amount of gratitude in my heart for his belief in this mission and the belief of what Melissa and Mark championed when they trained Minnie and Gilbert. What makes this even more remarkable is the host home of the mother dog Petra was Melissa's neighbor, and they trained the dogs together. In fact, Jordy dog sat for Gilbert. Petra, the mom dog, was initially supposed to have the F litter, but she wasn't ready. So now she will have and has had the guided by Gilbert litter. In another remarkable twist of fate, I realized the timing of this litter going into training will coincide with the anniversary of the shootings. The Guided by Gilbert litter was born on March 28th. There are 6 girls and 3 boys. Representative Bierman and the caucus helped name the dogs, and I'm going to announce them here for the first time today. The names are Ginger, Jenny, Gaia, Gertie, Gwyneth, Gemma, Gideon, Griffin, and Gus. Thank you, Senator Wickland and Senator Hemmingsen-Jaeger, for your investment in supporting this litter. Is incredibly important to us, to our staff, and to the Hortman family. The state's financial support will ensure a lasting legacy with a ripple effect touching many lives throughout the coming years. I have said that we will say Melissa, Mark, and Gilbert's names every day at Helping Paws. We will honor them by bringing light into the darkness, and with this litter and this support, we'll be able to carry their spirit and change lives, just as Melissa, Mark, and Gilbert changed all of ours. So thank you again, being part of the pack. We can change so many lives through the use of service dogs. We're happy to answer any questions, and I can now hand it over to Angie and our little star over there, Orla.
Thank you, and good morning, and please, if you could state your name for the record and begin.
Yes, thank you. My name is Angie Foley, and I'm with my service dog, Orla, who is under the table right now, and we are a graduate team of Helping Paws. Thank you, Elisa. Also, thank you, Madam Chair Wickland, Senator Hemmingsen-Jaeger, and members of the committee for the honor of being able to speak before you as someone who has been involved with Helping Paws for over 20 years and have received the gift of independence 4 times through the partnerships with my service dogs, Milo, Abeler, Pepper, and now Orla, who I've been matched with for just 3 months. In June, Pepper and I had the privilege of being part of the Helping Paws Honor Guard during Melissa, Mark, and Gilbert's line in state in the Capitol Rotunda. It was especially meaningful because Gilbert was actually Pepper's nephew. And I believe Orla was there too when she was still with her foster home trainer at the time. In addition to receiving service dogs through Helping Paws, I have been very involved in the organization through attending their events, volunteering with the organization, serving on the board of directors for 9 years, including 2 years as board president, speaking on graduate panels to foster home trainers about my experience having a service dog, and playing a role through my background as a clinical psychologist to develop and implement the program for veterans and first responders with PTSD. And I do not do this out of obligation to an organization that has literally changed my life for the better. I do all of this because it is a way that I can give back to Helping Paws and show how grateful I am for everything they do for myself and people with disabilities. When people think of Helping Paws, they likely think of puppies. But when I think of Helping Paws, I think about the people. From the dedicated staff, to the caretaker homes that provide the foundation for our breeding program, to the graduates, but mostly to the volunteer foster home trainers in the host homes, like Mark, Sophie, and Melissa Hortman, that dedicates so much of their time and energy to only selflessly hand over these gifts of independence to someone who needs them more than they do. I knew the Hortmans and interacted with them at the various Helping Paws events over the years. I do not have to tell you how wonderful they are, and I am not going to use the past tense because I am a strong believer that they never really leave us because their legacy remains. Most of the recipients of service dogs are on fixed and limited incomes. If they had to pay for the cost of all the expenses, including the care, time, and love put into 2.5 years of training, it would be out of reach for every graduate. The people who apply for Helping Paws, the recipients, only pay a nominal application fee, and then when they get the dog, a equipment fee. So we really depend on donations, sponsorships, fundraising, and other avenues to carry out our mission. I can think of no better way to honor the Hortmans and Gilbert's legacy than to sponsor the Guided by Gilbert litter. On behalf of a very grateful service dog team, I want to thank you, Senator Hemmingsen-Jaeger, Chair Wickland, and committee members for the hard work that you do on behalf of all Minnesotans. Thank you.
Thank you. Members, do you have any questions or comments about the bill? No? Anybody online? I don't see any questions, but thank you both for coming. Maybe you could just describe, I guess, what daily interactions are like with your support animal and what others experience. That would be helpful.
Yes, thank you. My service dogs help me with many different tasks. I would say that the ones that I rely on the most, when I drop something on the floor, my service dogs will pick it up for me and they'll bring it to me. So say I'm in my car by myself and I drop my keys, instead of trying to get out of my car and finding somebody that I trust or feel comfortable asking to come pick up my keys for me so that I can be on my way, my service dog is right there to pick them up. She opens doors for me, both the ones that have the automatic door opener buttons to get into public places, but then also she'll open doors that have a rope attached to the handle. So doors like in my office at work, my refrigerator at home. She also helps with taking off like shirt sleeves, jacket sleeves, gloves, socks. She can pull them off and then bring them to me to put away, which is very helpful. She can get attention of somebody by barking to get help if I need assistance. She can also go find a person and bring them back to me to let them know that I need help. Turn on off light switches. I know that some skills that I don't use, but some of these dogs are trained to use, are being like a balance. So if you're going up steps, they take the steps one stair at a time and they pause so that you can regain your balance. Also, they can act as a brace. If you are on the floor and you have fallen and need to get up, the dogs will actually brace and you can use them as a support to get back up on your feet. I know for individuals with PTSD, the skills are the same, but they serve a little bit of a different purpose. So even though turning on and off light switches is helpful for me as someone with a physical disability, for like a veteran of PTSD, this allows the dog to go into a darkened room before them and turn on the light switch so that they don't have to enter a darkened room. The dogs are also taught like a grounding procedure, like rest your head, which can help calm people with anxiety, bring them back to the present moment. And for somebody with a disability, resting your head allows you to be able to inspect their ears and their face and put on their gentle leader, their gear that they wear. So a lot of the cues are the same, they're trained the same, but they serve different purposes for the population that they are given to.
Thank you. Any other questions? Senator Bolden.
Thank you, Madam Chair. I just want to extend a thank you to Senator Hemmingsen-Jaeger and both the testifiers for sharing that. It is helpful to hear, what that looks like day to day. This is a lovely way to honor Mark and Melissa. I think about after the assassinations, the message of Colin and Sophie to us was, think about what you can do to be in service and how to help. And this will allow more Minnesotans to be able to carry on that legacy and to be in service and to help others, and that legacy will live on. So it really is a lovely way to honor them. Thank you.
Thank you.
Thank you. Any final comments, Senator?
Yeah, just again, want to say thank you, and thank you for the testifiers for sharing. I think what you described, Senator Bolden, is right on. I think of the impacts and like the ripple effects. So, we have the impact of what Mark and Melissa and Gilbert have meant to all of us, but then to extend that to help, a litter of 9 puppies that will then go out and help people with disabilities or PTSD who will then be able to go out. I just think it's a lovely ripple. And you reminded me too, what they said was to pet a dog. So that's just kind of one of those things where we're sponsoring some dogs. So thank you again. I really appreciate your consideration.
Thank you, and thanks for bringing it forward. I think it is a really great way that we can honor her memory and move forward in such an impactful way. So Senate File 4771 will be laid over for possible inclusion. Thank you. And next we'll go to Senator Hemmingsen-Jaeger's Senate File 4337. Senator, when you're ready.
Hello again. So 4337 is a bill to help foster kids who are aging out of the foster care system have the ability and the tools that they need to grow into adulthood and become, frankly, productive working members of society. Foster kids are under the care and the responsibility of the state. And so I feel it is our responsibility to make sure that they're able to make that transition from childhood to adulthood. Under our child protection statutes, counties are required to help kids who are aging out of the foster care system obtain documents like birth certificates, permanent residence cards, that they're going to need to transition into adulthood and independence. These kids include many of which who have been abused, neglected, abandoned, or a victim of trafficking. And the unfortunate reality is that many of these agencies don't have the adequate resources to enable them to help these kids in the situation to get those documents. However, there is a group of legal service providers who do have the skills and expertise to assist counties to help these children, but they also need resources to have the ability to partner with counties to provide these services. And as you can imagine, the path for these kids is often complex, it's time-consuming, it's difficult for the children to navigate alone. So this bill would appropriate about $200,000 with a competitive grant program to ease the burden on counties and to help these vulnerable kids. It targets the sum to the kids most in needs, mostly kids who have or are eligible for legal status. And recent changes in law have defined labor trafficking as now a form of child maltreatment in Minnesota. So this bill also prioritizes kids who have been victimized by labor trafficking. Then this funding is estimated to help about 200 children. To be eligible to apply, legal services organization must demonstrate an existing partnership and relationship with the county social services agency, and that means that this working relationship is successful and already exists. I do have an A2 amendment. This is in partnership with technical assistance and feedback, both from the Department of Public Safety, Office of Justice Programs, as well as the Minnesota Association of County Social Service Administrators, or MACSA. And we also incorporated into the first engrossment is some really good feedback we got from the Judiciary Committee.
Thank you. This bill has been to other committees, but if Senator Bolden, if you could move the A2 amendment, are there any questions about the A2 amendment? Seeing no questions, all those in favor of the A2 amendment, please signify by saying aye. Aye. Any opposed? The amendment is adopted. Thank you. And did you wish to go to testifiers now?
Yes, please. I have testifier Madeline Lohman to my left here, and then Allison Griffith is here for questions.
Thank you, and welcome to the committee. And if you could please state your name for the record and begin.
My name is Madeline Lohman, and I'm the Advocacy and Outreach Director with the Advocates for Human Rights. Dear Madam Chair, members, thank you to Senator Hemmingsen-Jaeger for having me testify today. The Advocates is a Minnesota-based nonprofit that provides immigration legal services to people fleeing persecution, victims of trafficking, and unaccompanied children. Based on that work, I can speak to the impact of this bill on unaccompanied children, though the actual scope will positively impact other abused, abandoned, and neglected immigrant children as well. In our legal services, we work with unaccompanied children who often face instability when they arrive in Minnesota. Some are placed with relatives or family friends who may struggle to meet their needs. Others arrive without any family support in the state and end up in foster care. In these situations, County Child Protective Services may be involved. Sometimes counties identify a child who then needs immigration assistance, and sometimes during our legal screening, we identify a child who needs county support. Right now, both sides of that relationship are facing barriers to effective collaboration. The competitive grant program established by this bill would significantly reduce those barriers and allow counties and legal service providers to work together more effectively. The need is not abstract. Since 2020, over 4,000 unaccompanied children have been released to sponsors in Minnesota. Many of those are thriving, but for those who are not, this bill is a lifeline. The Advocates currently has open cases for 7 children who would be directly impacted by improved coordination between county child protection and immigration legal service providers. These children live all over the state. One is in Northwest Minnesota, another in Southwest, 3 in Southeast, and only 2 in the 7-county metro area, making the scarcity of immigration legal services outside the metro area especially difficult. These children range in age from under 10 years old to 17. 2 are in foster care, having fled abusive families in their home countries. 2 were living in Minnesota and experienced severe abuse by a step-parent, so CPS removed them from their homes. Another came to Minnesota with a parent, but was later removed from their care because of neglect. At least 3 experienced labor trafficking at the hands of their abusers. In addition to physical safety, these children need stability, trusted adults, and help navigating processes that are far too complex to manage alone, all part of what we do as legal service providers. These children who have endured horrific experiences deserve our care and protection. Part of that care includes ensuring they have the identity documents they need so that as they grow, they can secure employment and successfully transition to adulthood. This bill will foster the cross-system partnerships necessary to make that possible. I respectfully request your support, and thank you.
Thank you. And if you can also state your name for the record and begin your testimony.
I think she's just going to be here
Oh,
for
she's just for
technical
questions. Okay. I'm sorry, I just have them both listed as testifiers. Members, do you have questions about the bill? Senator Utke.
Thank you, Madam Chair. And before we get to questions, I would like to offer the A3 amendment.
Senator Utke offers the A3 amendment, which is in your packets, members. Senator Utke.
Thank you, Madam Chair. And members, we received the A2, which added a little bit more to the bill. The A3 just takes it further. As we looked at the language, we wanted to put a few more parameters in it to make sure that those that we're partnering with are going to be good partners, and we also have reporting. So just to go through the amendment briefly, it requires the commissioner to develop metrics to measure the effectiveness of the grant funds, that they're accomplishing the purpose that they're designed for. And prior to receiving grant funds, the grantees must provide the commissioner with any information the commissioner determines is needed to make that decision. And then within 90 days of the expiration of the grant, the commissioner must submit a final report to the chairs and ranking members of the legislative committees with jurisdiction, which would be Public Safety and Human Services. And then there's lastly a provision that if the grant funds extend beyond the 1 year, that there's an interim report. It's just making sure that everything's going according to anticipated and the desires by the author of this bill to make sure that things worked out. We've been adding language like this to some other bills here in the last number of weeks, just to tighten things up a little bit and make sure that our money that's going out is being used responsibly. And so that's how I see the A3, and would ask for your support.
Senator Hemmingsen-Jaeger.
Thank you. I really appreciate the thought in coming with the amendment to make sure that we are protecting kids kind of by protecting the funding streams coming in. I am going to respectfully ask for a no vote, however, because these are already existing relationships that these providers have with the counties, so they've already been very thoroughly vetted. If you look at OJP's webpage, they have a whole webpage designed just for grant programs. You can click through each class of grants and it will give you language that was appropriated, the person it went to, and it gives you kind of all of the guidelines I feel that you're describing here in your amendment. We did add the language in the A2, as you mentioned, to kind of make sure we tightened up already existing practices. And then I just do want to highlight that there's a statutory reference, 16B.98 subdivision 12, which has very specific reporting requirements for grants over $250,000. And I misspoke, this is a $300,000 request. So I feel we are covered, and this would be the most efficient way to not get things crossed by having conflicting cross statutory references, is to kind of have things as we have them now. So.
Senator Utke, any response, or other members? Do you have any questions or comments about the amendment? Okay. Senator Utke.
Madam Chair, I guess I appreciate the author's comments and such, but I still believe that in our current day, where we're having, a new problem surface almost weekly, the way it seems with fraud and abuse and such, I don't think we can be too cautious. As I read the bill, to me, even though we're dealing with ongoing relationships, it doesn't seem like it's tight enough. And I'm hoping that in the end, at some point, we can do something like this amendment is asking to do, because once again, I don't think we can be too sure of ourselves. Somebody's always a step ahead of us, and so that's why I brought it forward, and I would still ask for your support. So thank you.
Other member questions or comments about the amendment? Senator Kupec.
Thank you, Madam Chair. Before we, I guess, vote on this, can you provide maybe some examples of what types of nonprofits would, be applying for this grant?
Senator Hemmingsen-Jaeger.
Certainly. Some examples include the Immigrant Law Center and the Advocates for Human Rights.
So, any other questions? I have a question. I'm not sure if council would be able to answer, but Senator Hemmingsen-Jaeger referenced the other statute that has a lot of description about how grant management needs to happen and the requirements for grants. And could you tell me, Ms. Hoffman, if this added language would that supplement what is already required, or is there any difficulties that presented if there are things that are conflicting or slightly different provisions? Yeah, I'm sorry I put you on the spot, but I was thinking that we do have, we did work, a couple years ago to put in place a lot of strong grant requirements, and we have, I just want to make sure that if we consider adding particular requirements, that I understand, how that would affect any of the other requirements. Senator Abeler.
Well, thanks, and just briefly, we spent $1 billion in 2023 on a bunch of grants, and I don't think anybody knows what good it did. And as a system, we're systems people here, and it'd be nice to know what the effectiveness is. And I just saw this amendment just now, but particularly in paragraph 1, the commissioner must develop metrics to measure the effectiveness in accomplishing the purposes. And so going forward, I think I would welcome this kind of language on the next bill I have. Just what did we accomplish with the money? And I think we'd be surprised as a committee how much money we send out and how it's not of much merit. And so I'm all for the bill. I think it's a great bill, so that's all. That's my 2 cents for the morning. Thank you.
Ms. Hoffman-Litchi?
Chair Wickland, members of the committee, so section 16B.98 subdivision 12, it requires a grantee that enters into a grant agreement over $25,000 to provide a report to the commissioner, and then the commissioner must make that report publicly available online, and the report must summarize the purpose of the grant, state the amount that was provided to the grantee, and then also include a written performance evaluation of the work that was done under the grant. The language in the A3 amendment goes beyond those requirements. The grantee must provide more information to the commissioner. The amendment would require the commissioner to develop metrics, which is not included in the language of this statute, and also the report would be provided under the amendment to the chairs and ranking minority members of the legislature. That is not required under the current statutory language.
Thank you.
Madam Chair.
Senator Hemmingsen-Jaeger.
Thank you. Could I please have my other testifier give her experience, please?
Sure. Ms. Griffith, if you could please state your name for the record and you can provide feedback.
Madam Chair, Allison Griffith, supervising attorney with Mid-Minnesota Legal Aid. Committee members, thank you for listening to my testimony. The committee member had mentioned that there was a previous allocation of funding to ensure that folks have access to work authorization. And part of that funding went to immigration legal services. I just want to state that there's extensive reporting required for the funded parties. That funding has revolutionized intake in the state of Minnesota to ensure there's no wrong door for folks to go to, provided extensive clinics across the state, and expanded access to immigration representation across the state of Minnesota. We could, there's regular reporting that goes with that funding. This is a different request specifically for non-citizen youth. There's no funding going to non-citizen youth who need help obtaining permanent resident documentation and proof of status as they age out of foster care.
Thank you. Senator Bolden.
Thank you, Madam Chair. I would ask for a roll call on the vote on the amendment.
Oh, thank you. A roll call is requested. Roll call will be granted, and I didn't announce at the beginning, but we do have members online. Any other thoughts or discussion about the amendment? Senator Etke.
Thank you, Madam Chair. And just one final thought as I'm listening to the conversations around the table here that kind of jumps out, and it was part of what's in the amendment, just so members are thinking about that. We've heard about the reporting that's currently required and such, but I think a big part of it too is whether we're chair, ranking member, or members just sitting around the table, there's so much going on that how often do we actually go seek out a report? I don't think it happens very often, but this amendment requires that report to be sent to the chairs and ranking members. So it's going to show up in the inboxes of our computers and hopefully be something that we take and look at. So I think that's an important piece there too. We do want to know that these dollars were used effectively and efficiently. And that report showing up, I think, is a pretty big indicator that hopefully the job was done right. But it does report back, and it was mentioned previously, we send out so many dollars on grants every year, and we really never know the results. We've had those conversations before. It's great to have people in front of us talking about these programs. That's how we learn more about them, and I appreciate that. But I think these reports and the follow-ups are a good idea. So again, I would ask for your support. Thank you.
Thank you. And any final comments, Senator Hemmingsen-Jaeger? Or do you have any other comments about it? Okay. I will just say that over the past 3 sessions, we have, in this committee, we've talked about different ways to increase accountability. And as I've worked on some of the omnibus bills, we have put in language, specific reporting requirements, and we've tried to get more comprehensive metrics developed when we see a program that doesn't have any guidelines on that. So I'm not opposed to this kind of language and in setting up metrics and a way to review the results. I'm a little more concerned about just whether the language is tailored to what this provision would be trying to get at. And we do also, I just want to mention for Senator Abeler that we did require the Department of Human Services and DCYF and MDH all to provide grant reports to us. And so that is something that we have received now from all 3. And those reports are meant to include, all the grants and where they are in statute and, a lot of information about each grant. It doesn't give results, but it's meant to help us better understand where the money is going in all our grant programs. So that is a work in progress. Members, I guess in this particular case, my concern is just that that the specific requirements for this reporting, I'm just not entirely sure if they match what is desired for this particular grant allocation, but I'm willing to work on it more, and I'll just leave it up to members to vote the way they see fit on this amendment. And Ms. Ryan, if you could take the roll, please.
Chair Wickland,
No.
Vice Chair Mann,
No.
Lee Dutke,
Yes.
Senator Abeler. Yes. Senator Bolden,
No.
Senator Fate, Senator Coran,
Yes.
Senator Kupec,
Yes.
Senator Liskey,
Yes.
Senator Port.
No. There being 5 yes votes and 4 no votes, the motion does prevail and the A3 amendment is adopted. Further comments or questions about the bill? I don't see any other questions or comments. Senator, any final thoughts?
Yeah. Thanks again for the discussion and for your consideration. I would love to work on a way we can get that A3, now that it's incorporated, to be more specific and more applicable so that it works with everything. So looking forward to working on that. Like I mentioned earlier, I really feel as state legislators and senators that we must honor our responsibility to the kids that are in our care, in our state's care. And this bill helps those kids. It helps our already resource-strapped counties with providers that are vetted. And this is protecting, I feel now it's protecting state funding with our OJP practices, with our bill language, and I just would really strongly request your support and appreciate your time and consideration. So, thank you.
Thank you for bringing it forward. It does seem like an important aspect that isn't getting the attention it deserves, so I appreciate you bringing the bill forward. And Senate File 4337, as amended, will be laid over. Thank you. And next we move to Senate File 4449, Senator Abeler.
Well, thank you, Madam Chair.
Senator Abeler.
Appreciate the opportunity to present this. At the end of the day, kids got to read. We've had an interesting discussion already with, my friend Representative Portman's, little memory again, and reality comes too hard sometimes, and the foster youth and the challenges they face, and so kids got to read though as well, and so that's the point of this. It's a small amount of money. And I don't know if we have any money, but, you know, some things are worthy. And so I bring this bill to you today. There is an author's amendment, Madam Chair, that A2. And what that does, so it gets rid of the earmark for this place and gives it to Ramsey County. Full disclosure, Ramsey County has not bought into this all the way yet, but if this bill should go forward, I think we want to find a way to protect the good efforts with, I just ran into the governor. We did a mental health thing, and so he was going to go ahead of me. And so as he walked in, I said, "Hey, thanks for being my warm-up band," as I went after him. And then we somehow got talking about earmarks, and he says, "We're not having any." So just to encourage us all. And he did a pretty good job, and they were all warmed up for me. So that was really good of him. So, Madam Chair, I'd like to move the A2.
Senator Abeler moves the A2 amendment. It's an author's amendment. All those in favor, please signify by saying aye. Aye. Any opposed? The A2 is adopted.
And Madam Chair, there's an
Senator Abeler.
A1 as well that I'll take up at the end of testimony, and that could be distributed now. So when you look at it, you go like, oh, that's an interesting amendment. So just to save time, I have some testifiers who will be very eloquent about this, and so I'll just turn it over to them, Madam Chair. Thank you.
Thank you. Do you, in person, we have two people online, and then maybe one of those is here too, but if you want to go first, if you could please state your name for the record and then begin your testimony.
Madam Chair and members of the committee, I believe Chip Martin is online and
Okay.
ready to
Would you like-
testify. He is the board chair for Minnesota's Rally to Read.
Okay, we will go to Dr. Chip Martin. And if you could please state your name for the record and begin.
Absolutely. My name is Edward Martin Chafee. I'm a pediatric cardiologist and neonatologist, but my patients call me Dr. Chip. I am primarily in St. Cloud, but I'm also on the faculty at the University of Minnesota in the Department of Pediatrics. I'm also at the medical school, and I'm also one of the co-course directors for our new arm of the medical school here in St. Cloud. As Tim said, I'm also the board chair for our initiation for Rally to Read. And I am also a proud Michigan graduate from medical school. That's why I'm wearing my Michigan sweatshirt today. And I would like to thank Madam Chair and the committee members for listening to our testimony today about our Rally to Read initiative. I really appreciate it. And I am fully supportive of our Rally to Read initiative for $250,000 for this appropriations bill. And this is a public-private matching fund request. Our guru, Tim Meriden, who approached me one day and said, I have a BHAG. I have a big, hairy, audacious goal. And that goal is for Minnesota to increase its reading proficiency amongst children across the state, to achieve that with the lowest number of inequities as possible, and to have a fierce urgency to fund this need now. And like you senators, I am also at work right now. I am in my clinic, but I've carved out some time to talk about this with you in between my patients, so I appreciate your patience if someone walks in. So first, a little bit of science. Brain development, 80% of it is completed in the first 3 years of life. And during those 3 years, that brain development includes synapse and wiring that actually promotes reading readiness before 5 years of age. Children are ready to read before they walk into their first kindergarten classroom, before they meet their first kindergarten teacher. But we never harness that reading readiness. And we see it time and time again with children who are not reading ready by the time they get to kindergarten. And then they spend their grade school, middle school, and high school years trying to catch up, constantly being behind because their reading proficiency is not up to snuff. And that takes time away from other studies, that takes energy from other studies, and that can cost a lot of money to try to even get them caught up if we even succeed in doing that. This reading initiative has 3 strategies that we plan to use to try to improve reading readiness. Reading readiness, sorry. Why is that important? When I'm in the operating room with babies that are on the table getting their hearts repaired, when I'm in the NICU with preterm babies who are 2 to 3 months early, here in the state of Minnesota, we do a very good job of getting those babies off the table with their hearts repaired and on their way home. We do a great job with little squirts in the NICU, getting them repaired, getting them home, getting them off the ventilator with their families, to go to grandma's house for sleepovers or to have sleepovers and picnics with their friends. However, I always worry about their neurodevelopmental outcomes. Are we doing the best for them in protecting their brains and in promoting their neurodevelopment and cognitive abilities? By harnessing those 3 years of brain development, we can not only improve the reading readiness and reading proficiencies for all children in the state of Minnesota, but specifically for those 2 populations of children that I take care of. So, what's our strategy? We have 3. 1, the Rally to Read initiative goes into every community in the state of Minnesota, from the northern borders and the Iron Range down to the southern edge by Iowa. And we meet with communities and talk about the different strategies that help to promote and improve reading proficiency and reading readiness, but we ask them which of these strategies will work in their communities, which ones can they access, which of these can they use, and tailor-make to their populations to start working on reading readiness in children under the age of 3 years. 2, we ensure that every parent with a child that's under 3 years of age has a brain builder tool set and toolkit available for those 3 years while those children are working on their proficiency and reading readiness. And then 3, we partner with the sports teams here in the state of Minnesota to get them on board with being supportive of reading readiness and reading proficiency. And I think we don't just stay with the sports teams. I think we go to college teams. I think we go to high school teams. Remember, athletes are leaders in their communities, and if athletes lead, others follow. If we can get those athletes at every level to believe in and to support reading proficiency and reading readiness, I think we can reach even more children and more families with this initiative. So that's our strategies, but we have a couple aces up our sleeve too. 1, we have the twins that are already on board. And the twins have already committed to not just a Rally to Read, but a Kids and Parents Rally to Read initiative, where they are interested in giving Rally to Read rewards to folks who come to the games, with them giving out books at their games, and then also distributing age-appropriate reading materials for younger kids to try to promote reading literacy. And they also are going to ask other sports teams in Minnesota to help with this initiative and to also participate in reading proficiency. And then 2, Capstone, which is a children's publishing company that publishes children's books. They're in Mankato, and they're already in. They donated $5,000 to the city of Mankato to begin their own Rally to Read initiative in the city of Mankato, and they are partnering with United Way, Mayo Health Systems, the Southwest Minnesota Initiative Foundation, UW Reading Festival, BEST, the Book Bus, and other local collaborators, and they have committed to donating $600,000 worth of books annually for us to distribute with this initiative. And that $600,000 is more than the matching grant that we needed to secure. To conclude, there's an African proverb that says, if you want to go fast, go alone. If you want to go far, go together. I want to thank Madam Chair and the committee members for inviting us to speak today and listening to me speak and share my thoughts with you today. And I look forward to us going further together as we work to improve the reading proficiency for children throughout the state of the great state of Minnesota. Thank you. And I now would ask Dr. Bernadette Johnson to speak with you.
Thank you. And now, Dr. Johnson, if you could please state your name for the record and begin your testimony.
Good morning, Madam Chair and members of the committee. My name is Dr. Bernadette Johnson. I'm an associate professor of educational leadership at Minnesota State University Mankato and previously served as superintendent of the Minneapolis Public Schools. I want to thank you and your colleagues for your leadership in passing the Minnesota READ Act. This landmark legislation aligns our policy and practice with the science of reading, and we know that when implemented with fidelity, it works. The READ Act reflects both our shared urgency and our shared belief that we can and must do better. Teachers are essential to this work, and nothing I say today diminishes that role, but teachers cannot and should not do this work alone. READ requires strong partnerships with families and communities, and this partnership begins well before a child enters a classroom. Supporting literacy doesn't start in kindergarten, it starts at birth. Long before teachers apply the science of reading, a child's brain is already being shaped by language, relationships, and experiences. This is why culturally and linguistically responsive approaches matter. Children's home languages, cultures, and lived experience are strengths, not barriers, and we must be able to reinforce those. Taking liberty with an old African proverb like my friend did, it takes an entire community to raise a proficient reader. It takes parents and caregivers who first nurture language, child care providers and early educators building on the foundation and supporting interventions in parent education. Language development does not begin in school, nor is it confined to the classroom. It begins at birth. This is why Minnesota Rally to Read is so important. It recognizes that literacy starts early, as I said, and focuses on reaching families and caregivers, especially those whose children face the greatest opportunity gaps. Rally to Read is a grassroots, community-driven innovation that taps Minnesota's greatest strengths, our social capital. And that local ownership is exactly what drives sustainable change, because we know that this works in urban core will differ from how it works in suburban communities, rural towns, and tribal nations. So building on the local ownership will sustain this change. The shift required by the READ Act is significant, but parents and community coalitions can help accelerate progress by rallying around teachers and schools, supporting them rather than leaving them to carry this work alone. Communities can also use shared data and benchmarks to hold themselves accountable for results. Members of the committee, I urge you to vote in favor of this appropriation bill so that Minnesota can fully realize the promise of the READ Act and ensure that every child, regardless of zip code, has the foundation they need to thrive. Thank you for your time, your leadership, and your commitment to Minnesota's children. I'd like to invite Julio Villay Sr. to testify next.
Thank you for your testimony. And we have one more testifier, Mr. Villasenor.
That is me. I won't make you say my last name. So Madam Chair, members of the committee, thank you very much for having us this morning. My name is Julio Villasenor. I have the pleasure of working for a local Fortune 500 company as a senior marketing manager. I'm very active in their Hispanic employee resource groups, but I'm here today in my private capacity as a board member of Minnesota's Rally to Read. I come from a family that is passionate about reading. My wife is a special ed teacher in District 196. My mom has always been very involved in literacy efforts. As a new immigrant to this country, I especially appreciate how vital reading is to living out the American dream. Opportunities that exist in the US can't be tapped without the essential skill of reading. It opens up new worlds. It makes the inaccessible accessible. While the problems of illiteracy crosses the socioeconomic strata of our state, it disproportionately impacts those living in pockets of poverty and communities of Black, Indigenous, and people of color. There's also an opportunity gap for children of different learning abilities and between genders. Teaching a child to read is the great equalizer. It is one of the best strategies for reducing inequalities in Minnesota. Tragically, however, Minnesota has one of the worst reading gaps in the country. The literacy gap is not just an educational hurdle, it's a workforce and consequently economic crisis. The consequences of a child not being able to read are staggering. It erodes a child's self-esteem, confidence, and triggers shame. For many, it unfortunately also becomes a pipeline to prison. We do not have to live with this failure of effectively teaching our children to read. We can invest in literacy now or choose to pay for the consequences later in the future. Economists, including our homegrown champion of early childhood education, Art Rolnick, a former senior vice president and director of research at the Minneapolis Federal Reserve Bank, have calculated that the inflation-adjusted 18% annual ROI from helping a child learn how to read early on. This comes through in better education, economic, health, and social outcomes. So imagine if communities across the state were also rallying to read, if we were sharing best practices, having friendly competition, seeing reading as something that is talked about at sports events. I joined the Minnesota Rally to Read board to help mobilize the business and corporate community. I believe it is in all of our best interest to teach kids early on how to read. So with that in mind, I urge you to vote in favor of this bill. Thank you for your time.
Thank you. And Mr. Reardon, are you available for questions, or did you wish to testify as well?
Madam Chair, I am available for questions,
Okay.
and I do want to point out, we have a board member who is an artist who is depicting and capturing what we're saying, and we'll give that to you, Madam Chair, when we're done.
All right, well, thank you. Members, questions or comments about the bill?
Madam Chair.
Senator Abeler.
You know, the more I learn about this, the more interesting it seems as another way to try to crack the reading literacy barrier. And, you know, I think trying to make reading cool with the twins and these other groups and cool doctors like Dr. Chip and, you know, on all that, really make a difference. So I hope that there's some way to do that. So I think so I do have another amendment I want to offer, Madam Chair, and it's not the traditional author's amendment, but I'd like to move the A1, and so especially if it could be posted, and then I'd like to talk about that, and then we'll see where that discussion goes briefly. I know there's a shortage of time.
Senator Abeler offers the A1 amendment, which I don't think is in our packets, or is it?
Was it passed out?
Okay.
Oh, you have it,
Let me
yeah.
look for it.
So, Madam Chair.
Senator
you know,
Abeler.
The people who have a struggle reading, sometimes they have economic challenges. And so some of them may need to go to a hospital that serves those individuals, like, HCMC, for instance. And this is, that's how these are linked. And I'm not sure if you want to vote on it today, Madam Chair, but I have been really burdened about the idea about what is going to happen. And I would score like not even less than 1% that we're going to do a 1% chance of passing a 1% sales tax. And so I think the state needs to weigh in on this. This is a three-part amendment. The first is that it suspends the surcharge for 2 years, creates a pot of money, which could be, this is a crude version, it's just getting the conversation going. It could be made into an uncompensated care pool. It could be tilted toward those with high Medicaid populations and much less of a reduction to those that have almost zero. Or lower ones. But I think the statement is, I think that we need to dip into the state's money and deal with HCMC and not suggest that another increased tax for Minneapolis is anything worthwhile. The second thing is it maximizes the rebasing for hospitals to the most recent possible number. The benefit of that is that it's an existing program and it funds the rates, and the feds have nothing but money. They're only short $39 trillion. And so inviting them to share a little bit more, they won't even notice it. And this is a pretty big need. And the third thing is talking with them. There's a bunch of Department of Health regulations which really don't serve much purpose, or at least which could be suspended given enough thought and discussion. And this would require that if the board and the MMA agreed unanimously that they could request a waiver from any of those particular things. I have no idea what those are, but there are some things that are unduly burdensome, which I'm told by HCMC it would not affect patient care or safety, but it's just a burdensome rule. So that's my amendment, Madam Chair. And I presumably be more discussions, but I'm bringing this as a good faith effort just to add more conversation into what seems like a vacuum. As I read the paper, all we're talking about is 1%. So, Madam Chair, you're offered, I'm willing to take a comment, and I don't plan to take it to a vote. So, thank you.
Okay, thank you, Senator Abeler. I think they're interesting concepts, and I think that maybe it appears that the 1% is the only thing under discussion, but that isn't the case. And I think we do have to consider what are the possible ways that we can address HCMC's needs. It's really important. I mean, we had the hearing when they came and explained, kind of their situation, and I think we all expressed that this is something that we need to address this session. I appreciate you bringing forward other different ways that we could possibly do that. I will say, hospital rebasing, we did 3 years ago in 2023, we proposed that some limited amount in the Senate and brought that forward, and that was not accepted by the House at the time. So we were hoping to accomplish part of that. The other ideas, and I'm not opposed to that, but it does require significant resources. The other items, I guess I need to know more about your rule waiver concept. I don't know that I have a reaction to that at this point, but thank you for bringing these ideas forward for discussion. Members, do you have any comments? Senator Coran.
Thank you, Madam Chair, and thank you, Senator Abeler, for picking a unique and creative way to almost double the time we've spent on, or at least double the time that we spent talking about Hennepin County Medical Center and the critical need. And so, Madam Chair, I guess the question, I think all Minnesotans have the question, why does it matter to us? Right? Many of us are from rural areas, and most don't understand why it matters. But we're going to be asked to try and find a couple $100 million, and we've had a 15 or 20-minute conversation in our committee here today. Do you plan to have, in the very near future, maybe an extended hearing to talk about what that solution might look like? I know it is extraordinarily complex, but we're going to have to convince Minnesotans that spending a couple $100 million matters to them. And then what are we going to do from a comfort perspective to know that the governance of that hospital system and that medical care system is functional? I've met with the county board members, and I'm not confident they're going to be able to run a hospital. But we had a board that ran the hospital, and are in the financial situation because of many things in the population they serve and the critical needs. But what do we plan to do? Because, I mean, I think we got to know what their governance looks like. We got to know what are they doing to bend the curve costs. And no matter what we do, it's going to be maybe a couple $100 million in cuts in services. And why it matters to all Minnesota, not only level 1 trauma, the burn unit, the addiction medicine treatment they provide, the training network, and for not every, but many doctors come through that entire infrastructure. So Senator Abeler's amendment, I don't know that it addresses it. It addresses it because we're talking about it, but we haven't had any material conversations yet in any committee. I think they've gotten a House committee on the proposed repurposing of the tax, of the sales tax. That's going nowhere. That's clear, and it's not going anywhere in the Senate. And so I'm just kind of curious. We need a plan, and this is probably what we should have been hearing today, and or at least tomorrow or Thursday to spend a good amount of time to vet this. So, Madam Chair, do we have a plan?
Thank you, Senator Coran. I mean, I think we have identified, we did have the hearing to talk about the issue. We have, there is work going on in the background. I will say that as it is a non-budget year, we don't have a traditional target setting mechanism that we're using this year, which has made it very difficult to say, we want to commit X dollars to any given proposal, because we don't have, like, I don't have an HHS target to work with. So I think part of the reason that it isn't looking like a budget year, it's not a budget year, and so we're trying to do the best we can to make sure that we're considering the really critical needs that need to go forward this year. HCMC addressing the financial issues there is definitely one of those critical needs, and we will be bringing a bill forward this week. It is just getting jacketed. Unfortunately, that has also taken a lot of time this year to get things through the revisor process and get them jacketed and introduced. So you will see that soon. And so you have my commitment that we will have a discussion about what the options should look like. I think you're right. We need to include, along with a monetary solution, we also need to consider how do we develop accountability and transparency in any of the options that we bring forward. And that's definitely been in my mind, or on my mind, as we come forward with ideas that are specific to this year and what we can support. The tax bill that repurposes the ballpark tax that will get introduced, and I don't know how that's going to move forward at all, but it will be under discussion as well. So I think there will be more discussion in our committee this week, and I'm happy to learn more about, the specific concept that you're bringing forward, Senator Abeler.
Thank you, Madam Chair. And I
Senator
just ask
Cran.
when we get to see whatever that bill is, I think that probably should absorb the entire committee time. We don't, 2 hours is probably not enough, but we've got to figure out how to dedicate and bring everybody. North Memorial's currently taking the load. They have one more financial year. They're going to be in the same boat. And so we need to have that comprehensive look so we're comfortable moving forward with all of those, with an understanding not just the rescue of that institution today, but everyone that depends on it. We have to bring them to the table so so everybody understands what those issues are and why it matters to Minnesota. So thank you, Madam Chair.
Thank you. Any other questions? Senator Radke.
Thank you, Madam Chair. A lot's been said already, and I know this wasn't on your agenda, so I appreciate the conversation here. And my encouragement would be just that we need the conversation sooner rather than later. HCMC doesn't have a year to wait for us to think about it and come back next year. So I just hope that I'm looking forward to seeing what you are putting together in your bill, and so that we can have that conversation, because they are so important to our whole state. And so just thank you for letting us have a little input here.
Any other questions or comments about Senator Abler's A1?
Yeah, so, Madam
Senator
Chair.
Abler.
Well, and I appreciate the discussion, and I hope you see this as a friendly effort to help the discussion get moved forward. If you get anything out of my proposal here, it's, I think, this is probably the most pressing issue the state has relative to our committee and to actually many committees. And I don't think a tax is the way to go. I don't think it's practical. But I think that there should be a target. We should dip into the till, and with state dollars do that this year, even given that we're challenged in the future. This is, in my opinion, the only place I would spend money out of the current budget. But I think it's important, and so if there's an uncompensated care pool or whatever, but I think that pot of money that the surcharge represents, you cut a tax from people that you're trying to subsidize. So, Madam Chair, thank you very much. And with that, I'll withdraw the A1. And I also want to thank the committee's attention to the rally to read thing. And I think the testimony was quite profound. And so thank you, Madam Chair.
Senator Abeler withdraws the A1 amendment. Thank you for bringing this bill forward. I do appreciate, as someone who has worked a lot on early childhood issues, I really do appreciate that this work, the Rally to Read program, is going on. I mean, I think it will definitely benefit. We know that so much brain development is happening from that 0 to 5 age group, and anything we can do to help parents really develop the reading skills early is beneficial. So thank you very much for your time and bringing this forward.
Thank you, Madam Chair. Thank you, Committee.
Senate File 4449 as amended is laid over. Next, we will go to Senator Dahms. Senator Dahms has Senate File 3698. Welcome to the committee.
Well, thank you, Madam Chair and members. Thank you for hearing the bill today. I do have the A1 amendment, Madam Chair. If it's a delete all amendment, which will put the bill in the shape that I would like to have it. So if that could be moved, Madam Chair.
Senator Utke moves the A1 amendment. Members, all those in favor, please signify by saying aye. Aye. Any opposed? The A1 amendment is adopted.
Thank you, Madam Chair. And Senate File 3698 as amended gives direction to the Commissioner of Children, Youth, and Families to develop a licensing framework for the crisis nurseries for children, youth, and families. This bill addresses the practical regulatory issues affecting a nonprofit in my district. Ivy House Crisis Nursery in New Ulm. Ivy House provides free short-term crisis childcare for families facing temporary emergencies, whether there's a medical situation, housing instability, or another actual acute hardship. Just to be clear, this bill does not reduce safety standards. It does not create new entitlement programs. What it does is establish a licensing structure that actually fits the services being provided. Currently, crisis nurseries must operate under dual licensure structure where they're designed for entirely different purposes. One governing a traditional daycare, the other governing long-term residential facilities. The result is a regulatory mismatch which creates operational challenges and makes the application across the state extremely difficult. This bill clearly creates a framework so that providers can operate safely and transparently under standard tailored to the crisis care. And Madam Chair, I have two testifiers today from Ivy House. We have Amber Collins and Steve Turvold. So Madam Chair, at your wishes, if you would like to turn it over to the testifiers.
Thank you for that. First, yes, if you could state your name for the record, Ms. Collins, and, or is he going to go first? Okay, Mr. Turvold, state your name for the record and begin.
Thank you, Madam Chair. My name is Steve Turvold. I am a volunteer board member with Ivy House Crisis Nursery down in New Ulm. Ivy House provides free short-term crisis child care for families facing overwhelming circumstances. These are parents that are navigating medical emergencies, housing instability, and mental health challenges and other temporary crises when they need a safe place for their children while they stabilize their situation. Our services are voluntary, short-term, and we are prevention-focused. In the past year alone, we responded to 500 helpline calls and provided nearly 1,000 days of free child care. That reflects a significant need not only in New Ulm, but in surrounding communities and farther. We have supported families from as far away as Maple Grove. Last year, we had the opportunity to speak at the Minnesota Social Service Association Conference. Since that presentation, we've had conversations with professionals and community leaders from across the state who recognize the same service gap in their regions. We've received calls and queries from communities asking how to establish a crisis nursery. Some have been from neighboring communities and others have been from much farther away, including a conversation with an individual from the Iron Range who sees firsthand how families there lack short-term crisis childcare options. What we're hearing consistently is this is not an isolated need. Counties, nonprofits, and local leaders understand that traditional childcare does not meet emergency crisis needs, while residential facilities serve a different purpose. Short-term crisis nurseries can fill that prevention space in between, helping families before situations escalate into deeper system involvement. The challenge, as Senator Dahms said, is the current dual licensure structure is not replicable design for crisis nurseries. Organizations that want to step forward encounter regulatory barriers and operational confusion that makes replication extremely difficult. This legislation would create a clear, specific licensing framework tailored to short-term crisis nursery operations. It does not request taxpayer funding. It simply establishes the appropriate structure so communities across the state can safely and effectively provide this preventative service. We believe this is a practical solution that strengthens families, protects children, and allows communities statewide to respond to a clearly identified need. Now, Madam Chair, my friend and Ivy House founder, Amber, would like to speak.
Welcome to the committee. If you could please state your name for the record and begin.
Madam Chair and members of the committee, thank you for the opportunity to speak today. My name is Amber Collins. I am the founder and interim executive director for Ivy House, a crisis nursery in New Ulm. A little bit about my story. I have a degree in elementary education. After teaching in Duluth, I focused my continuing education on learning more about infant mental health, the effects of toxic stress on children, ACEs, adverse childhood experiences, and child abuse prevention. I had moved to Minneapolis and started volunteering at the Greater Minneapolis Crisis Nursery. During my time there, I saw firsthand how powerful short-term crisis childcare can be. I saw how families would come to the crisis nursery overwhelmed and unsure of where to turn. I saw how powerful it was when they were given a safe, judgment-free support. When I moved to southern Minnesota, I realized that this service simply did not exist in communities outside the metro area. Families were facing the same kinds of crises, but without the same prevention option. That realization is what led me to start the Ivy House. Ivy House has been open since June of 2017 and provides free, short-term, voluntary care to families in crisis. Over the past year, we responded to hundreds of helpline calls and provided hundreds of free days of care. Each call represents a family trying to do the right thing for their child during a difficult moment. On your information sheet, we gave some concrete examples of reasons why families reach out for help from a crisis nursery. The reasons are extensive. We don't define what a crisis is for a family, so therefore we get calls for every type of situation. We know that this needs extends well beyond New Ulm. There is clear interest and demand for our services. What stands in the way is not willingness, it is the current licensing structure. Crisis nurseries do not fit neatly into the existing daycare or residential facility regulations. Those systems were designed for different purposes. The dual license framework creates confusion and operational challenges that make it extremely difficult for communities to replicate this prevention model. People who want to open an Ivy House in a new community are stuck. This legislation would establish a licensing structure that reflects how crisis nurseries actually operate. It would maintain safety and accountability while removing regulatory barriers that were never intended for this type of care. It does not request taxpayer funding, it simply creates clarity. From my experience, both in the Metro and Greater Minnesota, I can confidently say that this service fulfills a critical prevention gap. It strengthens families, protects children, and allows communities to respond before situations escalate. Thank you for your time and consideration. I'm happy to answer any questions.
Thank you very much. Senator Dahms, did you have any other comments, or we'll go to questions from members?
Just a couple of other comments, Madam Chair. There is a fiscal note that was provided. That fiscal note was done prior to the newest amendment. The new amendment, or the amendment, Senate File 3698 as amended, is what has been come up to an agreement between the department and the players in this. So this is what caused this amendment to be brought forward, is this is now the language that the department has agreed to. So with that said, I don't know this, I think the fiscal note would need to be updated because there was some changes.
Senator Dahms, thank you. Yes, that's helpful to understand, and we will have to ask about updating the fiscal note then based on the change, because it is significant change to the original bill. So thank you. Members, do you have any questions or comments about the bill? Senator Edke.
Thank you, Madam Chair, and I just have to congratulate the two testifiers. They got Senator Dahms to come to HHS. I don't think we've seen him here in a long time, so welcome.
Thank you.
Any other questions or comments about the bill? No, I'm seeing none. Thank you, Senator Dahms. I know this has come up in the past, that there's this tension between what is being provided and what the existing licensing frameworks we have in place. So I appreciate your work on this and coming forward with a way to see if we can get that cleared up. So thank you. And if you have any final comments?
Well, thank you, Madam Chair and members. In my view, this is, I would say, a very common sense regulatory adjustment that removes the conflict that we currently have with having two different licenses. It makes it much easier to get this license put into place and to do this work without always being concerned about if you're meeting the regulations of both the license that you have. So I think it's very important that we move this forward. And thank you, Madam Chair and members.
Thank you, and thank you to the testifiers. Senate File 3698 as amended is laid over. Thank you. And now we will move to Senator Johnson, Senate File 4457. Welcome to the committee, Senator Johnson.
Thank you, Madam Chair. I think in the 3 years since we've switched over gavels, I've been able to successfully avoid
this committee. My luck ran out today, but we're excited to be here regardless. So thank you, Madam Chair and members, for the opportunity to be here today. So Senate File 4457 is a bill dealing with drinking water and a regionalization of the drinking water systems. And so you might ask, well, why are we here in front of this committee today? And it is because of the jurisdiction of MDH over drinking water in the state of Minnesota. And so in my area, we have many small towns consisting of 800, 1,200, 2,500 people. And as each municipality and community establishes safe drinking water systems within their communities, they have to hire on engineers and expensive projects within each community itself to make sure that they have adequate drinking water that meets the standards of the state. What has happened in my district is they have come up with the idea, and it's not original or new, but it is the first time that we've done this throughout the 3-county area up in my neck of the woods of Norman County, Clay County, and Polk County, is putting together a system that delivers clean drinking water to each of these small communities, so they're not investing in infrastructure, expensive infrastructure in each individual community itself, but using more of a regional system coming out of a single or multi-point source that'll help give consistent and cheap water to these communities. However, one of the problems of establishing these systems is the upfront costs. They're not eligible for USDA dollars. They're not eligible for some of these grants because they don't have a legally established district. And so what this bill is doing today, Senate File 4457, is establishing a grant to allow communities and counties and districts to be able to do the engineering, the legal costs, a lot of those soft costs that need to be done up front without the dollars to make sure that we can establish these districts. So we can go through the bill, or else, Madam Chair, to your discretion, we could go over to the testifier today if you'd like.
Sure, if you want to provide your testimony, if you could please state your name for the record and begin your testimony.
Madam Chair and members of the committee, my name is Ezra Baer. I serve as Clay County Commissioner from District 2, representing the northern half of Clay County. Thank you for the opportunity to testify to support Senate File 4457. I also want to sincerely thank the bill sponsors for recognizing the critical need to invest in sustainable water infrastructure for rural communities. I also serve as the county's appointee to the West Central Regional Water District, a new regional drinking water system currently being formed by Polk, Norman, and Clay County. With the involvement of more than a dozen cities and collaboration from rural residents, this is the first regional water district formed under Minnesota Statute 116A since the mid-1980s. The need is urgent. In Clay County, approximately 39% of tested private wells exceed the health standards of 10 micrograms per liter for arsenic. Also, according to Minnesota Department of Health, roughly 50% of private wells statewide contain manganese, also above health-based guidance levels. At the same time, small communities in my district, such as Felton and Georgetown, are struggling with operator shortages and growing cost of maintenance, aging infrastructure. In many cases, these systems are one failure away from losing reliable access to safe drinking water. In response, our counties have come together to pursue a regional solution for long-term service of life of 100 years or more. However, through this process, we have learned firsthand why regional water systems have not been formed in Minnesota in decades. The process under Chapter 116A is complex, time-intensive, and costly. There are no dedicated funding programs to support the formation phase. By the time we complete the court administrative formation process alone, anticipated investment over $700,000, that's before design, construction, or even required intergovernmental agreements are completed. Still, the benefit of regionalization are clear to communities throughout the state, which is evident by the fact that the interest is growing despite the challenges posed by current law. In fact, both Wilkin and Coochin counties recently passed unanimously board resolutions to initiate exploring the process of district formation. Moreover, in your material today is a letter of support from the Minnesota Rural Waters Association, which notes at least 2 other proposed districts were unable to advance due to complexity and the cost of formation. So if the legislature creates programs like the one in this bill, in the future looks at modernizing the district formation statutes, we believe it would unleash a new range of options for local leaders to address drinking water challenges. I respectfully ask for your support for Senate File 4457. Thank you for your time and consideration.
Thank you. Members, do you have any questions or comments about the bill? Senator Utke.
Thank you, Madam Chair, and to either Senator Johnson or his testifier. As I saw this bill, to me it looks like it's a rural water system that we see, particularly from where you guys sit, west of you. We see it through the Dakotas and further west, but are the current, and I understand we do have a few rural waters in the state now, but they go back to the era that you were just talking about. They go back a number of decades where they were put in place. So this is to kind of modernize the rural water system and look at it in today's time.
Mr. Johnson, or Senator Johnson, or Mr. Bear? I don't.
Thank you for that. Do you want to answer? Go for it.
So yes, this would modernize it to, sorry, Madam Chair. This is to, and Senator, this would be to modernize the way to form one of these, because yeah, it's very cumbersome and it takes a long process. We've been at this for 4 years and we have our final court hearing in 2 weeks to hopefully the judge will sign off on the formation of this water district.
Senator Utke?
Thank you, Madam Chair. And just a quick follow-up. When you said you've been dealing with a judge for 4 years, what are the obstacles?
So we have
Mr.
to,
Bear.
Madam Chair, we have to notify, so we just sent out mailers to roughly 20,000 residents. So every landowner gets a mailer to tell them what we're working on. The other challenges are, it's just a lot of engineering costs that goes into it, and yeah, a lot of upfront costs that have taken a long time to get the money received to put it out there to go through the process.
Senator Utke?
Thank you, Madam Chair. Thank you. Appreciate it.
Any other questions? Or Senator Kupec?
Thank you, Madam Chair, and thanks for coming today with this bill, which I am on. And I've been involved with these discussions, and it's almost, you have to do this before you do that, but then you got to do that before you do this. And these entities that want to form this, there's no funding mechanism for them because they can't form legally and then proceed until they've done other things. So there's no pool of money available to them. And for rural water districts, on the health benefit side, yes. Also, all of these little communities that have their own little operating systems, they're all aging out right now at the same time. Rural water is a much more economical way for them to go to pool their resources together. But it does take a little bit of legal finagling to form this district, which is basically a new entity. So to have a pool of funds available for this would be really great, and in the long run will save us probably in bonding dollars rather than every little community coming and saying we need to replace our water tower, we need to replace our filtration plant. If they can centralize it and pool their resources. And yes, our neighbor to the west in North Dakota has almost the entire state through rural water districts, and we haven't done any since the 80s, partially because this rule is really complicated and it's really difficult for these authorities to get going. So I'm really happy that Senator Johnson's carrying this bill. I'm proud to be on it. So if we can find some money for this, that would be a wonderful thing.
Thank you. Any other comments? Senator Johnson, thank you for bringing this forward. This bill we will pass it out to the Capital Investment Committee, and it won't be a responsibility of this committee to fund, but hopefully within the Capital Investment Committee, Senator Pappas will be looking for a way to do that. So, and seeing no other questions or comments, Senator Utke moves that Senate File 4457 be recommended to pass and be referred to the Committee on Capital Investment. All those in favor, please signify by saying aye. Aye. Any opposed? And the Motion does prevail, and Senate File 4457 is passed and referred to the Committee on Capital Investment. Thank you
Madam
for
Chair.
coming today.
Thank you, members.
Next, we will move to Senator Kupec, Senate File 4170. Senator Kupec.
I was so wrapped up in the last bill. I was like, oh yeah, I'm next. Sorry, thanks. So we have Senate File 4170 here for you, and this is to change add-in for student loan forgiveness for physical therapists and physical therapist assistants. Minnesota faces growing demand for rehabilitation services, especially in rural and underserved communities. Workforce shortages make access difficult. This bill allows physical therapists and physical therapist assistants to participate in Minnesota's Health Professional Education Loan Forgiveness Program. Currently, they are not allowed to participate in this loan forgiveness program and have limited loan forgiveness programs dedicated to the profession and none at the state level. The existing program offers loan forgiveness to healthcare professionals serving in high-needs areas, including rural and underserved communities, and is already administered to the health professionals by the Minnesota Office of Rural Health and Primary Care. PTs and PTAs who commit to working for 3 years in designated rural communities or underserved urban areas, federally designated shortage areas, would be eligible for loan forgiveness, just like many other health professionals. The bill does include a $500,000 appropriation to add them to this loan forgiveness program.
Thank you. And you have a testifier. Ms. Smith, if you could please state your name for the record and begin your testimony.
Madam Chair and members of the committee, my name is Allie Smith. I'm a physical therapist and a professor at the University of Minnesota in their physical therapy program. I'm asking for your support for SF 4170, which would make PTs and PTAs eligible to apply for the Minnesota Health Professional Education Loan Forgiveness Program. This program offers awards annually for high-need medical roles in underserved and rural communities in Minnesota. The program currently includes healthcare providers such as physicians, mental health professionals, pharmacists, and dentists, but there are no rehab professionals that are eligible to apply, including PTs and PTAs. PTs and PTAs help manage chronic conditions, prevent falls, help with recovery after injury, and provide care in primary care clinics. By 2033, 1 in 5 Minnesotans will be over age 65, a population that increasingly relies on PT services for mobility and fall prevention. At the same time, the demand for PTs and PTAs is expected to grow by 10 to 24%. Ensuring all Minnesotans have access to PT services will help them avoid complications and higher cost care, saving the state and the patient money. And many of our students come from these underserved and rural communities. They want to return home to work. Many of them stay in the cities to earn more and pay off their debt sooner. Loan forgiveness could help them return to work in their communities. Please support this bill that would make PTs and PTAs eligible to apply for the Health Loan Forgiveness Program so that we can take care of the Minnesotans who need our help the most. Thank you.
Thank you. Members, questions or comments about the bill? Senator Bolden.
Thank you, Madam Chair, and thank you, Senator Kupec, for bringing this bill. I have a number of people from my district have contacted me about this bill. As you can imagine, I have a number of physical therapists in my district, and they are advocating for this, and rightfully so. So thank you for bringing it forward. Because folks reached out to me, I learned that the average PT graduates with about $142,000 in debt, and 90% of them carry debt with them, and so that's significant. And so. It is a profession that is needed, especially in rural areas. And so I think it makes sense ways that we can support folks to be working where they want to, but also where it's needed in these rural areas, underserved areas, I think makes sense. So thank you.
Other member questions or comments? Seeing no other questions, I appreciate you bringing this forward. I think we're always trying to find ways to encourage people to go into health professions, and knowing that the debt that many come out of school with is such a sizable amount. It makes sense to be able to add this to this fund and appropriate some additional funding for it. So any final thoughts, Senator Kupec?
Sure. I would just like to thank, I think, we've done a lot of work in this committee, I think, with physical therapists to bring the group forward in a more professional status and recognize the work that they are doing within our community. And I think this fits nicely with the work we've already done.
Thank you. And with that, Senate File 4170 is laid over for possible inclusion. And members, we are waiting for the author for Senator Hoffman is on his way to the room to present the next bill. Welcome, Senator Hoffman.
Thank you, Madam Chair and members.
You have Senate File 1018.
Yep. It's the Greater Twin Cities. Madam Chair and members, it's the Greater Twin Cities United Ways 211 Resource Helpline. And that essential work aligns closely with the role of government. It connects residents to the critical resources in a transparent, efficient, and human-centered way. This proposal is about leveraging that trusted statewide system to deliver better outcomes for people that are served and navigating complicated systems with a one-stop shop. And it's a continuity of care issue that we always talk about, comprehensive, coordinated, and collaborative. But what this does is it provides real-time caller data that's informed the community responses by offering timely, actionable insights into emerging topics. And that really does the identifying of trends such as spikes in housing instability or food insecurity. And that really grounded decisions in lived real-time experiences from callers. 211 helps partners that in a proactive response. It strengthens coordination across systems and ensures that support reaches communities when and where it is needed the most. There's a proposal sustains a proven service while making strategic improvements and provide within Minnesota. The next bill actually has an amendment, not this one. So thank you, Madam Chair.
Senator Hoffman, I do have an A1. It's a delete everything with the appropriation. Looks like a slight modification. Oh, it makes it a one-time appropriation. So Senator Bolden offers the A1 amendment. Members, all those in favor, please signify by saying aye. Aye. Any opposed? The A1 is adopted. And now we can go to your testifiers. Welcome to the committee, Ms. Lewis. If you can state your name for the record and begin.
Madam Chair, if it's all the same to you, I would like for Kendra Morales to start.
Sure.
Thank you.
Ms. Morales is online. If you could please state your name for the record and you can begin your testimony.
Good morning. My name is Kendra Morales. Morning Chair Wicklund, Vice Chairman, and members of the committee. Thank you for giving me the opportunity to testify today. I am here today on both as a staff member of United Way 211 and a community member whose life was directly impacted by this service. 20 years ago, I called United Way 211 during a domestic violence crisis. I was afraid, I was overwhelmed, and I was unsure on how I was going to keep myself and my children safe. During that call, I wasn't rushed, I didn't feel judged, I felt seen, heard, and validated. In that single conversation, I was given information and resources I needed to stabilize my family, such as safe housing, food support, clothing, school supplies, and connections to support groups. At a moment when everything felt overwhelming, 211 gave me clarity, tools, and hope. In 2019, I had the opportunity to join United Way 211 as a community resource specialist, the same role that helped me during my greatest time of need. Since then, I've been promoted to assistant manager, contact center, and the opportunities that role open ultimately led me to becoming a homeowner. Everything that I've built, my stability, my career, and my home started with one call that was made on the worst day of my life. United Way 211 doesn't just help people survive a crisis. It helps people stabilize, rebuild, and thrive. This one-time funding ensures that Minnesotans can reach out for help and continue to find that trained professional with compassion on the other end of that line. Thank you so much.
Thank you very much. And Ms. Lewis? Yes.
First, Madam Chair, first I want to thank Senator Hoffman here for being the chief author, as well as Senator Bolden for your support and sponsorship of SF 1018. Chair Wicklund, Vice Chairman, and members of the committee, my name is Stephanie L. Lewis. I am the Associate Vice President, Advocacy and Community Impact at Greater Twin Cities United Way. For many Minnesotans facing a crisis, the hardest part isn't qualifying for help. It's knowing where to start. That's where 211 comes in. 211 is Minnesota's front door to health and human services. It is free, confidential, and available 24/7 statewide. It connects people to basic needs such as housing resources, food support, and utility assistance. When someone is overwhelmed or in distress, 211 simplifies a complicated system into a single trusted number. Beyond supporting individuals, 211 functions as critical community infrastructure. Nonprofits, funders, and public administrators routinely rely on 211's real-time data to understand emerging needs and guide resource allocations and response efforts. Social service professionals use the 211 website as a referral tool, and many counties list 211 as a preferred resource for residents seeking help. Demand for 211 has grown significantly. First quarter contact volume has nearly doubled since 2020, with housing-related requests increasing by nearly 180%. During periods of emergency and disruption, most notably in 2022, contact volume surged dramatically, demonstrating 211's role in absorbing spikes in community need and supporting access to services without overwhelming other systems. When 211 does not have adequate capacity, the consequences are real. Calls go unanswered, wait times increase. People don't stop needing help. Many turn to county crisis systems, while others do nothing at all because they do not know what to do next. As a result, problems escalate and require interventions that are more complex, more costly, and far more time-consuming. That is why state investment matters. The request before you is for one-time legislative funding. This targeted support would strengthen infrastructure, improve response during periods of high demand, and ensure continuity while longer-term sustainability solutions continue to develop. 211 supports multiple systems at once, including healthcare, housing stability, and aging services. By helping people reach the right help at the right time, 211 reduces unnecessary downstream interventions and helps protect public resources. Committee members, 211 works. Minnesotans rely on it when they are at their breaking point. This one-time investment ensures that when someone reaches out for help, Minnesota is ready to answer. I respectfully urge you to support our 211 funding request, and I'm happy to answer questions.
Thank you very much. Members, do you have any questions or comments about the bill? Senator Bolden.
Thank you, Madam Chair. And thank you, Senator Hoffman, for your work on this bill and carrying it. I think, this is important in normal times, and I'm thinking now about how many families, how many Minnesotans are struggling now who maybe weren't before. And so in a time when people are needing supports and resources more than ever, I think this is critically important. In the flyer you all handed out, nearly 200,000 calls last year is significant. That is a lot of Minnesotans, and it's not just one person, it's families that affects. And so in a time when more people are food insecure and more people are housing insecure, and just the challenges that families are facing and being squeezed in many, many ways right now, I think ensuring that there are resources for when people are struggling to be able to connect them to those resources so they know where to go and what to do is just so important. So thank you so much.
Thank you. Any other member questions or comments? No? I'm seeing none, but Senator Hoffman, thank you for bringing this forward. I think it seems like a vital resource, and the advantage of, providing additional funding to this resource is that it really gets at needs across the state. You have the technological capabilities to, help people all over. And I appreciate the data gathering that you do that helps the entities in those areas respond and know, what the needs are. So, Senator Hoffman, any final comments?
No, Madam Chair, you're spot on, and thank you, Senator Bolden, for your kind words. Over almost 200,000 phone calls last year alone in 2025. I mean, it is a needed resource within the state of Minnesota, and it's worth our investment. So, thank you.
Thank you. With that, Senate File 1018 as amended is laid over. Thank you. And next, Senator Hoffman, we have Senate File 2638.
Thank you, Madam Chair and members. And there is, after conversations with the Department of Health and folks, there is an A1 amendment. I'd like that brought forward, please.
Senator Bolden moves the A1 amendment. Members, it's an author's amendment. All those in favor, please signify by saying aye. Aye. Any opposed? The amendment is adopted. Senator Hoffman.
Thank you, Madam Chair. I almost said aye. It's been a long time. I missed this committee. Pleased to present Senate File 2638. It's a bill that's aimed at supporting the growth of geothermal energy in Minnesota while continuing to protect the public health and our groundwater resources. This bill addresses key barriers faced in urban and space-constrained areas by signaling when appropriate, MDH could consider setback variances for emerged closed-loop heat exchanger systems unless, Madam Chair, there is a clear risk to public safety. As you can see, the bill language contained in the amendment, which you all just accepted, does not weaken protections. Rather, it just clarifies the standards so that these low-risk technologies are not limited by standards developed for different types of systems. And by the way, Madam Chair, the well systems in Minnesota haven't been looked at since 1993. And so this is long overdue, and it really does. It's creating a more workable, transparent process while maintaining the strong oversight. Willie Miley, Regulatory Director for Darcy Solutions out of the University of Minnesota, is here, and then Andy Campo, I think with Pipe Trades, is either going to join us, or I think Andy's here. So thank you, Madam Chair.
Thank you. And Mr. Miley, if you could state your name for the record and begin your testimony.
Good morning, Chair Wicklund and committee members. Thank you.
Mr. Miley, if you could pull the microphone closer or sit closer to it.
Yes.
Thank you.
Is this good?
Yes, thank you.
Thank you. Good morning, Chair Wicklund and committee members. Thank you so much for the opportunity to testify today. My name is Willie Miley. I'm the Regulatory Director at Darcy Solutions. We are a geothermal technology company focusing on groundwater-enabled geothermal heating and cooling systems. Our company grew out of technology that was initially developed at the University of Minnesota, and we're based in New Brighton, Minnesota. One distinct benefit of our primary geothermal technology is that it does not require large areas of land like most traditional geothermal technologies. Therefore, our systems can be installed at sites with limited land space and in dense urban areas where traditional geothermal systems are just not possible. This is a game changer that now allows many more property owners the option to install a geothermal clean energy system and to achieve the benefits of significantly reduced emissions and lower total cost of ownership over the lifetime of the system. But it is often difficult on compact or urban sites to find suitable locations for the geothermal wells in terms of effective system design, but that also comply with all of the isolation distance rules, which are also known as setback rules, which have been established for conventional water supply wells many years ago. The water well setback rules are also applied to geothermal wells, even though the risk profiles for geothermal wells are significantly lower because they do not withdraw groundwater for consumption and they pump groundwater over a much smaller area. So to address this challenge, we have worked on this bill with input from the Minnesota Department of Health to clarify the process for obtaining a setback variance for projects where it is not possible to design a fully effective geothermal system and comply with the standard setback rules that are there for typical water supply wells. The bill requires the geothermal wells to be built to highly protective construction standards, which mitigates any potential risks with installing the geothermal wells in these locations. This bill will provide much needed clarity on obtaining setback variances for property owners and geothermal system designers, while also ensuring that groundwater and public health are always adequately protected. Thank you, Senator Hoffman, for authoring this bill, which will enable further development of geothermal clean energy systems and maintain strong groundwater protections. I also want to thank the Minnesota Department of Health staff for working diligently on this issue with us over the last several months. I respectfully urge the committee members to please advance this bill. Thank you very much.
Thank you. Mr. Campbell, if you could please state your name for the record and begin.
Yes. Thank you, Chair Wickland and members of the Senate Health and Human Services Committee. My name is Andrew Campbell, President of the Minnesota Pipe Trades Association. I'm here today to testify in support of Senate File 2638. The Minnesota Pipe Trades Association is an umbrella organization representing nearly 10,000 men and women working in the piping-related industries throughout Minnesota. Our members perform mechanical construction and repair work, including pump, plumbing, pipe fitting, HVACR service, gas distribution, and sprinkler fitting. As an organization, we support a robust and fair permitting process for all projects. As our members see less opportunities for work in the traditional energy sector, we must pivot and embrace emerging technologies as they come. We continue to view thermal energy networks and geothermal systems as a great employment opportunity for our members. As we see interest grow in these types of systems, we must consider how we can help remove undue hurdles that have the potential to slow implementation of these systems. Senate File 2638 does just that. It does not require the Commissioner to approve variances or curtail the permitting process in any way. It will require a variance to be considered when needed. We hope this will make it easier and give more interested parties the ability to install these types of systems in the future, providing more employment opportunities for our members in the process. In closing, I would like to thank Senator Hoffman for bringing this issue forward, and I would also like to thank the committee for their time and consideration.
Thank you. Members, do you have questions or comments about the bill? Senator Abeler.
Thank you, Madam Chair, and I support the bill, and I'm hopefully that, I don't know how many years we've talked about all this closed loop slant, there's so many things, and it just seems like it's such a, a no-brainer to do this, and I hope that there's the obstacles that are unnecessary can be removed so we can do more of this, and it just makes so much sense. So thank you, Madam Chair.
Thank you. Senator Utke.
Yeah, thank you, Madam Chair, and thank you, Senator Hoffman, and your testifiers there. Just jumping on the bandwagon with Senator Abeler. This is well past due. We know how long it You know, I think we've been talking about this for a lot of years, and finally, a couple of years ago, this finally got put in play. I see it as the department slow walking this, and some of these requirements that have been brought forward for well locations and stuff, I think are just a continuation of that slow walk. And so I appreciate the fact that this opens up the variance process and brings some common sense into play. The only thing I would suggest, Senator Hoffman, is maybe we should have a report on these variances after a period of time to find out if they're actually working, because we want to make sure that we're making this more user-friendly, because it's a great thing that we can do. And when we position a well 1,000, 1,200 feet or whatever from a building and then expect that to be an efficient system, it's not. So all I can say is I fully support what you're doing, and I hope this is a giant step forward. So thank you.
Senator Curran.
Thank you, Madam Chair, and thanks, Senator Hoffman, for bringing the bill forward. I'm hoping there's not a lot of teeth in here. It sounds like they could do something. Maybe it's some design requirements, but I've got conflicting information, and so maybe you can help me out. Everybody says you're here today because of industry and businesses that want to put in a more effective heating, cooling system. I think we promote it and we give rebates and refunds and we promote it as a green energy. They're telling us that 9 out of 10 are not approved. And so what I'm conflicted with is the information we have. Department of Health says that 49 of 52 were approved since 2023. And so what I'm confused on is it approved under standards for which they've created under the isolation requirement, and thus the project is abandoned because of it brings it out of compliance? And so I'm trying to match these two things up, that we've got information. MDH doesn't see a problem, and that they've proved the vast majority of them, but that's not what we hear. That's not what we've heard from the people trying to do the work, the people who do the work, that want to do, the building owners, the construction people. And so I'm confused if yes, they approve it, but they add the isolation requirement that then makes it incompatible or isn't cost effective. So if you can provide some clarity around that, it'd be wonderful.
Senator Hoffman?
Yeah, Madam Chair, and then we'll go to Willie on this. But I'm glad Senator Cran, Madam Chair and Senator Cran, I'm glad you raised that point, because if you look at Senate File 2638 as it originally existed, there was a little bit more teeth in that. And to your point, the department, now the real ask is the commissioner must consider a variance, right? I mean, I go to Senator Utke's point, there should be some data. We know this works, right? But when you have a well system that hasn't been updated since 1993, Senator Curran, you got a systemic issue there, right? And so I'm all about more teeth in this, but in order to get the ball bouncing on this, that's why we went with the must consider versus the stronger language in the first one. And so with that, let's go to Willie here, Madam Chair.
Mr. Miley?
Madam Chair, committee members, yeah, thank you for the question. So there was a statute that got adopted with the originating legislation that put submerged closed-loop heat exchanger technology into Minnesota statutes and the well code. And there was a part in that statute that the Minnesota Department of Health interpreted to be highly restrictive of allowing variances for these type of systems. And we worked with MDH on a number of projects. We had one approved through variance, one variance approved for these type of systems. We had a few others denied. And once we understood MDH's approach on this, we just didn't bring projects forward that would face this issue, because it was a highly difficult process to get through and to get approval. So we had projects, potential projects coming to us, and we had to say, unfortunately, these projects will not be approved under variance. So that is why there could be far more data if we went through the full process, but it's not in our customers' interest or in our interest to do that, or it wasn't.
Madam Chair.
Senator Cran.
And thank you. And so it explained why Department of Health doesn't see a problem with it. But when you look at line 1.16, right, the variance application, you now, right, have to bear the third-party costs for criteria for which Department of Health is going to create. And I believe that's one of the areas where they lack the expertise. But if they lack the expertise to understand all components of well placement, the operations, all those aspects, I'm not sure how they had the expertise to create the original criteria for solving a problem that I'm not sure they've identified. So that's what I'm concerned about. And so, yeah, it's old, but how many, the experts at the table, how many glycol-based solutions that are out there relative to the new building, right, the new technologies out there? Most of them, if it is glycol, isn't a food-based glycol. Even that's not even the contamination worry. They're worried about the drinking water, or some failure in some wastewater or some sewer line that would then have a double failure leaking back into that well somehow, and that you then injecting it into some aquifer at some sub-level, which they can't point to it's ever happened, and nothing in the engineering of what we currently had would create a great risk. So I'm just, it's still, you're going to bear more costs. Hopefully it provides a pathway, but I don't see anything. I'm glad we're here, but it's still well, we just like you to be nicer type bill that we're not requiring them to do much. And so it's a great start, but we're going to need to find a better path for a clear opportunity to do business in Minnesota for businesses that want to have the most efficient heating and cooling system with the greatest and latest technology. So thank you.
I wonder if the department, do they want to provide some feedback on any of the discussion today? Just so we have a fuller picture of what's going on. Thank you, and if you could state your name for the record.
Sure. Do I need to turn this on?
No, it's okay. Just get it close to you, that's all.
Yeah. Thank you, Madam Chair. My name is Jennifer Wire. I'm a supervisor at the Minnesota Department of Health in the Well Management Program. And I can say that generally our concern with this bill is that it would cause us to prioritize the system efficiency of geothermal systems over groundwater protection, which is our responsibility and authority. We've had the pleasure of working with Darcy Solutions and others on the language, and we'll continue to work with them on the language. At this point specifically, our concern is about the independent third-party review that's required in the bill, and some issues with potential conflict of interest if the individuals who are working on the review are also involved with the project. But we're continuing to work with them on that, and we'll look forward to continuing to work on this language.
Thank you for that.
Sure.
It looks like the amendment does try to get at the third party being not someone who is employed by the variance applicant or the firm, but if more work needs to be done on that. Senator Hoffman?
Madam Chair and members, if you look at line point 1.19, mid-sentence, through any licensed professional engineer that is not employed by the variance applicant or the firm designing the submerged closed loop heat exchange is considered a third party under the statute. That's pretty clear. So I don't understand where the department continually, they haven't updated their well management systems program since 1993, Madam Chair. And so we can continue to just say that this is a priority, this isn't a priority, but in this case, you heard from Senator Cran, you heard from our folks from what used to be the University of Minnesota, and I just think that it's long overdue, and we just need to fix this now. So,
Thank you. Mr. Miley, final,
Yeah,
final
Madam
comment?
Chair, committee members, I just wanted to also respond to the comment by MDH that we feel, and we've talked to other members of the industry also, professional engineers, licensed well drillers, to come up with, or to kind of get a consensus that because it is a licensed professional engineer that does the third-party evaluation, under their licensure, the professional rules to which they are held by, that is adequate to indicate that it will be a third-party review that is done to the professional standards and that is done true to the work and the data that is involved with that. So we feel that is more than adequate to meet a third-party professional engineer evaluation.
Okay, thank you. Well, as this bill will be laid over, we'll continue to have discussions and see if there's just any more refining in the language that we can do. But, you know, I do think that technically, or technology is advancing, and I hope we can find a way to make sure these projects can move forward. So, Senator Hoffman.
Madam Chair, there's still room on the bill to get names to it, so a little email would be, and I was just hoping for old sake that you would have said, you know, let's send this thing to the floor, but I couldn't get that out of you, so we're good.
Not today, I guess, so. Senate file.
Thank you.
Yeah, you're welcome. Senate file 2638, as amended, is laid over.
Awesome, thank you.
Thank you very much, and reaching the end of our business, this committee is adjourned.